Dr. Aimee Johnson with Creature Comforts Animal Hospital, and the reason we decided to do this video today was to address the problem of pain in animals. And I have heard from many of my clients, and I've witnessed that they really don't understand what the signs of pain are in their animals, and it's really disturbing to them when I either later show them that their pet was really in a lot of pain and they feel I couldn't do anything about that, or I let that happen and I didn't know. And that's heartbreaking. It really is. So one of my passions in life is geriatric medicine, is pain control. I think that we are doing a better and better job, and we've learned so much from the human side. So with our pets, we are, or they are, depending on their owners to recognize their signs of pain and to help them out. And most people see their animals as, at least I hope so these days, as part of their family. Animals don't show their pain because they have not lost the instinct for survival. That's very different than them not feeling it. They do feel it, and their nervous system is basically identical to our own. And we know from human medicine, studying, years and years of studying acute pain versus chronic pain, it literally changes the pathways, the neural pathways. My goal is to help all of you out there to understand what pain looks like, how we need to address it, and make sure that these beings that have agreed to walk life's path with us, and we call them our pets, are getting the relief they deserve. So what causes pain? Really pretty much anything I do here in the hospital will cause discomfort to an animal. So from something as simple as giving a vaccine, to putting in an IV catheter or an intravenous catheter while they're in surgery, to the actual surgery. And then we're suturing our animals back up and we send them out the door. And we used to do this all the time with absolutely no go home or even beforehand pain control. All they got was whatever drugs were being used to anesthetize. What we want to do is make sure that from the moment we know we're going to do something with that animal, if it's a spay, if it's a castration, if it's a dental cleaning, that they're coming in and they're getting pain control from the moment they walk in our door. So they get a little shot, and it's got a sedative in it because we don't want them to be stressed while they're here in the hospital. It has a pain control in it. Then when they're under anesthesia and we're actually performing the procedure, I often will use things like local blocks. I do blocks on an incision area where I'm either taking a growth off or I'm doing a surgery. I will use drugs in a cocktail that's going to their intravenous drip. Then when they wake up, they're waking up comfortably and they're not thrashing about and they're not harming themselves further. And then later in the day, whether I'm sending them home or I'm keeping them in hospital, they're going home with pain control for usually 7 to 10 days. And that way I get the best results. We now know that animals who suffer chronic pain, uncontrolled pain, are 80% more likely to get cancer than those who have their pain controlled. So our guys get older, and I hear people say this a lot about their kitties. Well, a cat, after 15 years, has finally learned to not jump on the counter. Well, Kitty did not learn to stop jumping on the counter to please you. Kitty can't jump on the counter anymore because Kitty hurts, okay? Or you've got the kitty that you go to rub them and you're petting them down their back and they're all happy and purring, and then you reach that back in and they reach around and they bite you. That sign is, they're telling you, I hurt, don't touch me back there. And it isn't normal. You hear people say, oh, cats are, that's just a thing in cats. So we don't ever want to reach that point. And I'll often watch my patients as I'm examining them, and I'm just paying attention to what they're doing, and I'm asking clients questions, and I'll ask them, have you noticed any changes? Are they having problems? Do you think they're hurting? You know, he's a little slow to get up, but that's normal, and you know, he works right out of it, and yeah, he's like us, he's like me, he's getting older. It's an indication that he hurts. It's harder to get up. I'm hurting, I'm having some weakness, And then once I get up and I start moving and I'm warming up my muscles and I'm getting blood flow to the joints, it feels better. And that's a known physiological thing. Pain often causes animals to move less. They move less, they actually get more pain. And we want to reverse that. Never, ever, ever do we stop running or exercising or walking or swimming or whatever we've always done with these animals. We don't stop doing it. The second that you do, because you think it's in their best interest, the worse they get. So knowing the signs of pain, understanding that aging animals are going to naturally start having some breakdown and inflammation, and knowing that there are things that we can do to treat those guys who are at that point, and to do everything in our power from the moment I get them in as puppies and kittens to put them on a program that is absolutely going to be preventative. And my whole job here and my whole passion here is to do that from the time they're little bitty and treat it when we see it. But know that you should give the same level of care to these animals that you give to yourself.
He has bad lower back and he has breathing problems, and this dog is old. This dog's probably 17. And he's got a bad lower back, and it seems to help his lower back. It definitely helps his breathing. He sleeps all night. He doesn't wake me up all night. It's an herb, and I give it to him at night before he goes to bed, and he doesn't feel so tired the next day. He runs around, he plays more, he's more active. He had gotten where all he did was sleep. It's really improved his quality of life. He can walk, he can run, he can do a lot more things now. His quality of life has improved about 60%.
Uncontrolled pain is not just a physical problem, it quickly becomes an emotional and a mental problem. Uncontrolled inflammation leads to disease, disease causes inflammation, and so probably where I start with everything and anyone when it's a preventative maintenance program is I put my pets on a very good quality anti-inflammatory, and that's the starting point. I may actually send something home for their owners, and the feedback I get is they recovered so much nicer. They didn't have a problem with anything. If I'm doing surgery, it's before, during, and after, without a doubt. And my recovery periods are quicker, the animals recover better. And just the last thing, I also do a lot of integrative modalities when it comes to pain control. So I use everything from a non-steroidal anti-inflammatory to acupuncture, to chiropractic, to laser therapy, to essential oil therapy in some animals, to stem cell. We have tons and tons and tons and tons of tools in our arsenal. Now we just need to understand how to use them. And as an owner, I think it's your responsibility to be educated, and I'll do my darndest to educate you. And I will never ever recommend something I do not think is going to benefit them in some way. And if you will start as a preventative care program when these guys are little, you will have so much less problems when they get older.